Lovely. So welcome to all of you to this webinar. Special thanks to panel members and to all of the participants. So we have got all of the panel members here with us at the moment, except from one, Robert Sweetow, who will join us whenever he joins us. And so the plan for the webinar is I'm going to introduce the panel members, and then I will give a very brief presentation about the book, and then Brian will give a bit more detailed presentation about content of the book, and then we open discussions, and we also take questions from participants. And then, so my name is Hashir Aazh, and Brian Moore is the co-author of this book. And the panel members at this moment so far we have Paul Salkovskis. Paul is a professor of clinical psychology and director of the Oxford Institute of Clinical Psychology Training and Research. And we have Tricia Sheehan Scaglione, who is an assistant professor and director of UHealth Tinnitus program, United States. We have Jemma Hatton, who is a clinical audiologist and a specialist in tinnitus, hyperacusis, and misophonia rehabilitation at Royal Surrey Hospital in Guildford. We have Maureen Whittle, who is an associate clinical professor, Department of Psychiatry, University of British Columbia, and co-founder of Anxiety Canada, Vancouver CBT Center. And we have Laurie Jacomet, who is a postdoctorate researcher and tinnitus specialist and clinical audiologist at University of Antwerp, Belgium. And we have Ali Asghar Danish, who is a professor of audiology, Department of Communication Sciences and Disorders, Florida Atlantic University, United States. And the final panel member, who is not here yet, is Robert Sweetow, who is a professor emeritus of Department of Otolaryngology, Head and Neck Surgery, University of California, United States. And so thank you to all of you. And we have a mix of professors of audiology and psychology in this meeting, and I'm glad that you all made it. And so I'm going to do a brief presentation about my views on the book as an introduction to this webinar. I'm going to share my screen with my slides. So I like to start my presentation with a feedback from a patient who undertook the CBT for her tinnitus. And this is what she wrote after her therapy. I think tinnitus is a very specific condition that is very difficult to appreciate if you have not experienced it or you are not an expert in audiology. It is a condition that is with you all the time, at work or at rest. It is inside your own head and feels inescapable. It is not an outside problem or an external issue to be resolved. And to have someone understand that and combine it with knowledge of hearing loss and hyperacusis, etc., is extremely important. I have had more general CBT for other issues in the past, and think that targeted CBT approach in the audiology department made CBT treatment as useful and relevant as it could be. So this was a feedback from a patient who undertook CBT for tinnitus. And these are some of my thoughts that I wanted to share about generally CBT and the book. So the motivation for writing the book was to basically document the techniques that we have developed over the years in the clinic that have helped a lot of people. And then you always change things. and develop other techniques and move on and use different metaphors, and the previous one was getting forgotten. And so we thought that before we forget the things that we have done so far, so it's better to document that, and also to be something that people can use as a self-help tool for to help themselves dealing with tinnitus, which Brian will talk about that aspect of it a bit more. And in terms of the CBT for tinnitus and its similarity and differences to original CBT, and so in my view, the way that I look at it, it is like a conductor of an orchestra, and so you can the conductor can based on their own emotions and background, and also their understanding of the audience and the occasion, to make modifications in the music and change the tempo, adds bits and pieces into the musical notes are the same musical notes, but there are some changes that composer can make to match and suit the audience and convey the information that they want to convey. So in my view, CBT for tinnitus is consistent with original CBT, and but it's kind of modified based on our hearing and audiology background, our cultural background, as well as the trying to match this with the audience or the readers, which would be the people who have tinnitus, to kind of suit them the best. And in the book, we have lots of pictures, and our illustrator and graphic designer was Lika Kavili, and she helped significantly in developing different materials for the book. And for the cover of the book, I had to draw what I thought it needs to look like, and I sent it to her. And so I put all of the characters that were in my mind on this, and then she turned it to this, and we had all of the characters in the book, some of them on the cover. And then we were looking at this, there's too many men on the cover, so we got rid of Sigmund Freud, and instead we added Juliet from Romeo and Juliet. And so it wasn't only a change in the picture, we had to also reduce the references to Freud and increase the references to Romeo and Juliet. And this was the final cover of the book that we were suggesting to the publishers, and they looked at it and said, "Oh, this looks very nice, but no, we don't want this." I thought, why? They said, because it's nothing to do with tinnitus, and it is very confusing. So this cover that we developed did not finally end up to be the actual cover of the book, and the cover of the book is this, and which go with their Living Well with Different Conditions series. And so I thought that also it didn't make it to the actual cover to become the cover of the book, but I at least show this and share this to you because we worked very hard on creating this. And this is the poster for our book signing and seminar for patients, which is in Guildford, planned for 14th of November. So if you have patients who have tinnitus and you live in the UK, and you feel that they might benefit from attending this seminar, please feel free to share the details of this webinar, this seminar with them to attend this, because this is actually designed for members of the public. Hi, Robert. You're on mute. Robert, you are still on mute.
There we are. Hi there. Sorry I'm late. I apologize. I got messed up on California time. I'm visiting some friends in Chicago right now.
Lovely. I'm glad to have you here. I already have introduced all of the panel members, and we have a mix of audiologists and psychologists. So I did a small presentation about the bits that I wanted to talk about. Now it's Brian's turn to do his presentation, and then we open the floor for discussions and take questions from the audience. Brian, would you like to start yours?
Yeah. Okay, so what I want to do is to give you a brief overview of the book, to give you a flavor of what's in the book. And first of all, what's the book about? Well, it's intended as a self-help guide for people with troublesome tinnitus. So these are people who are bothered by their tinnitus. So it's not intended for the person who occasionally experiences tinnitus but doesn't really think about it and isn't bothered by it. It's intended to help people who are having problems because of their tinnitus. And it provides an alternative to treatment by a therapist or clinical specialist in situations where waiting lists are long or help is not readily available. And here in the UK, there are only a few centres that do any kind of therapy for tinnitus, and waiting lists are long. So we've thought that this book would sort of fill a need here. And what we're aiming to do with the book is to give relief from tinnitus distress in a way that's long-lasting. It shouldn't just fade away as soon as the treatment is finished, not be based on false hope. So we're not trying to promise things that we can't achieve. And the whole process depends on a change from within the person who's suffering from tinnitus. And we hope that the self-treatment provides the opportunity to become more resilient and function in a normal and confident way as a human being. So those are our general goals. Now, the general features of the book are based on the fact that at present, there are no cures for tinnitus. Many people with tinnitus, if you ask them, what would you like? They say, oh, I'd like a pill I could take and it would make the tinnitus go away. But that's not available. People have been working on it for years and there's no sign of something that's effective so far. So there isn't something that's going to make tinnitus go away completely. And in our opinion, the most effective treatment involves learning to manage reactions to tinnitus. It's not the tinnitus itself, but it's the reaction to it that creates problems. And a feature of the book is throughout the whole book, there are worksheets and questionnaires that can help a person understand their own reactions to tinnitus and to identify whether or not those reactions are realistic. So these worksheets and questionnaires help people to question what's going on inside themselves and to think whether any of these reactions that they're having and thoughts about tinnitus, whether they're actually realistic. And the questionnaires are also intended to help a person with tinnitus assess the severity of their reactions to the tinnitus, to assess how much the tinnitus is bothering them. And this allows them to monitor their progress over time. So the idea is they fill in some of these questionnaires early on in the program that they're learning for the book, and then they can fill the same questionnaire in later on and see that they've made progress, and hopefully they have made progress. And the book is organized in 10 steps, and I want to go through each of those steps in turn. And each step is illustrated with metaphors, real-life examples, and characters from history and fiction. And this goes back to the cover that Hashir illustrated that never actually made it to the book, because all those characters illustrated on the cover are ones who feature in these metaphors and examples that we give, stories from the literature and from history and fiction that go along and illustrate the processes that are going on when a person is distressed by their tinnitus. So step one is providing basic information about tinnitus. And we picked the materials in the chapter describing this step because they're based on questions that tinnitus patients often ask, and they're intended to deal with some common misconceptions about tinnitus and to help make sense of the experience of tinnitus. So we describe what tinnitus can sound like, what are possible causes of tinnitus, what its implications are for health generally, and so on. Now, tinnitus is often associated with hearing problems, although we think that tinnitus is not the cause of the hearing problems, it's just linked to them. There may be things that lead to hearing loss that also lead to tinnitus. And so in this chapter, we also give some information about when you should seek help for hearing problems, because if you have tinnitus, you may also have a hearing problem, and sometimes that needs medical attention. So we give some indications of when you might like to seek medical help. And in this chapter, we also give some examples of the bothersome thoughts and reactions of individual people in response to those tinnitus. And people who are bothered by tinnitus may see within themselves some of the same thoughts and reactions as are expressed in these examples in the first chapter. Step 2 is devoted to self-assessment. It allows the person with tinnitus to evaluate their own experience of tinnitus and things related to it, and the extent to which these are affecting them or us, because I think among the panel here are some sufferers from tinnitus. And this can make it easier for an individual to decide whether, okay, we don't need to go any further, our tinnitus is not really bothersome, it was interesting to read about it, but we don't really need to work through the whole program. Or the person can try to seek help from a medical professional or an audiologist, or they can try self-help working through the book. So this step really helps you to decide whether you want to continue working through the program described in the book. And in this chapter, we also give several questionnaires that the person should fill in, and these assess the impact of tinnitus, sensitivity to sounds in general, because some people are bothered more by everyday sounds than others, the noise of a nearby motorway or something like that. Another questionnaire assesses oversensitivity to sounds, which is called hyperacusis, where a person may be find certain sounds aversive or painful, which are not aversive or painful to most people. Another questionnaire assesses anxiety and depression, which can follow from bothersome tinnitus. A person who's bothered by their tinnitus may become anxious and depressed. And finally, there's a questionnaire assessing hearing problems, which can help to decide whether you need to seek help for those problems separately from seeking help for tinnitus. Okay, step 3 is about learning about cognitive behavioral therapy. What is it all about? And the treatment program described in the book is based on cognitive behavioral therapy. So in this step, we discuss the theoretical basis of CBT and how it's relevant to the management of tinnitus. And CBT is based on a specific way of thinking about the distress caused by tinnitus, and it's conceived in terms of interactions between our thoughts and our emotional and behavioral reactions. So when we think about our tinnitus, this may evoke certain emotions and thoughts. It may evoke bodily reactions, like our heart rate may go up, or we may start sweating or become more anxious. And all of these things can interact. And the CBT is based upon the way that these things interact and the vicious circles that can be produced by these reactions and interactions. So this is designed to help us understand how the problems caused by tinnitus might be managed effectively and reduced using CBT. So step 4 is we call it test the water, and that involves trying out some of the skills that are involved in CBT to get an idea of how CBT might work. So the idea is CBT involves learning to think in a certain way and react in a certain way. That's acquiring skills to do CBT. And this first step just illustrates how it might work. And some of these skills include tackling avoidance behaviors and rituals and tackling our fears. Now, some people, for example, have a fear that if they go into a noisy situation, it will make their tinnitus worse. And so they avoid those noisy situations. And on the whole, those avoidance behaviors don't help. And in fact, by staying away from those behaviors, you can kind of reinforce the belief that you're avoiding making your tinnitus work. But we would argue that in most cases, it's best to tackle those avoidance behaviors and rituals by trying to actually face them, to go into the noisy situation, to see how bad really things are, and to compare what really happens with what you thought might happen. And this may be difficult at first, but in the long term, we think that it helps. And by doing these preliminary tests of the skills involved in CBT, we can decide if CBT is something that we would like to pursue and to continue working for the book. And this step also helps to identify the key troublesome thoughts, which we call in the book hot thoughts, and also helps us to learn when we need to do CBT, when we need to use these CBT skills. Okay. Step 5 is the last step before really embarking on the therapy itself. So it's the final step in the preparation. And it helps us to take stock of what's been learned and achieved so far in dealing with tinnitus, and to identify room for improvement, to identify things that could be made better by applying CBT. And this step includes a questionnaire that's about your self-confidence in managing tinnitus and how it can be improved. So it's assessing at present, how confident are you that you can deal with your tinnitus and that you have any way of making it better? And of course, that questionnaire is repeated later on in the book to see what progress that you've made. So this step helps us to think about our current level of confidence in carrying out day-to-day tasks, resting, relaxing, and enjoying life without using distraction or avoidance. And it also helps us to think about what can help us to become more confident in doing these things. So step 6 of the book involves customizing your treatment. So this is the first step of the treatment plan. And the idea is that people with bothersome tinnitus aren't all bothered by the same aspects, and they don't all react in the same way. So we're trying to figure out what are the particular problems experienced by each person and to formulate a plan to deal with those problems. So this helps us to customize the treatment by creating a CBT model, a kind of explanation of the mechanisms by which we are distressed by tinnitus in terms of so-called vicious cycles, things feeding back onto one another. And the model can differ from one person to the next, as I said, and it can be used to describe our own tinnitus distress by writing down our own thoughts, emotions, bodily sensations, and behaviors when we experience our tinnitus. And this provides the opportunity to think about which parts of the vicious cycle which can be changed or modified to break the cycle and to lead to improvements. And this chapter on step 6 involves a worksheet to explore personal and life factors that might have contributed to the initial reaction to tinnitus. Okay, so step 7 is really the first major step of actually applying CBT, and we call it SEL, or Stop, Avoidance, Expose, and Learn. This was an acronym that Hashir dreamed up. So this step teaches us to stop our avoidance behaviors, to stop avoiding situations which we think might be difficult for us, to stop undergoing rituals that we may have to try and deal with our tinnitus, to expose ourselves to tinnitus in difficult situations and to learn from those experiences. And during the practice of stop, avoidance, expose and learn, we practice controlling our urges to use background noise or other distractions or rituals when we hear our tinnitus. We expose ourselves to what we are afraid of, and we learn if we can tolerate the uncomfortable feelings that tinnitus might produce. And most people find that when they try these things, it's not so bad as they thought it would be. Indeed, it's better. They learn that they can deal with these things. And simply by experiencing anxiety, irritation, or sadness that might be produced by tinnitus, we can improve our tolerance of these things, and eventually they decline. So step 8, we call Let the Sunshine In, and this was based on the comments of a patient who said that after the therapy, she felt like she was blowing away the dark clouds and letting the sun shine in. So this helps us to turn our learning from the SEL step into the antidote for our troublesome thoughts. So this step involves creating counterstatements that are used to neutralize the effect of tinnitus-related thoughts. And the chapter has a lot of description about how you can create these counterstatements. And we think these counterstatements must have certain properties. They have to be relevant to, but contradictory to, the corresponding negative thought. And they must be positively worded, and they must be believable to us, believable to the individual. And as I said, this patient reported how following this step, she felt like she was able to blow away the dark clouds of negative thoughts and let the sun shine in. Sorry, I missed the in off the end of the sentence there. Okay, then we have a step that we call Know, Keep On, Identify and Substitute, or KISS. So this step teaches us to know when to do cognitive behavioral therapy, which is whenever tinnitus is interrupting our activities or affecting our mood, to persist, to keep on in dealing with the negative emotions, to identify our negative thoughts about tinnitus, and substitute them with counter statements. And we give lots of examples of how you can do these things and what suitable counter statements might be. And step 5 also revisits something that we call rules of life. These are basic beliefs that we have ourselves, often acquired early on in life. And a lot of these may not be appropriate or productive. They may indeed be counterproductive. And this step 9 helps to teach us to identify these rules of life and how to modify them and change them and improve them for the better. And then finally, step 10 is what we call CBT style, and it's about integrating CBT into our everyday life. And it's partly about maintaining our process by preparing ourselves for setbacks. Now, in most treatment involving CBT, people experience setbacks. They may have times when they're particularly stressed, things are particularly difficult, there's some bad life event, and that makes their reactions to the tinnitus worse for a while. And the person has to be able to deal with that and learn to apply CBT to offset the effect of these setbacks. So these setbacks are part of our normal life, and if we are prepared, then we're less likely for them to escalate into a full-blown relapse. We can nip them in the bud before things get really bad. And the main action is to keep ourselves ready for dealing with the setbacks by making sure that we maintain our CBT skills. We revisit them, we revise them, and we keep them ready so that we can bring them into action as soon as things get a little bit bad. And this integration into our lifestyle is what we call CBT style. So I'll finish with this another quote from a patient where she said previously she felt like a little shrimp being overwhelmed by a tsunami, and she felt that there was a huge tsunami of negativity, pain, anguish, and everything. But now she feels more confident to blow away the tide. She doesn't need to avoid her tinnitus. Instead, she can use CBT to control her reactions produced by a change from within. And that's basically what we like to achieve with the book. So I'll stop there. Thank you very much.
Thank you very much, Brian. Thank you for everyone for listening. And so some of the panel members have actually read the earlier drafts of the book and give us comments, and we did our best to apply as many as comments as was possible, and some at a later stage read the final drafts of the book. So please feel free to share any comments that you like, and about CBT for tinnitus in general, or about the book, and if you find something interesting or not interesting. Paul, please go ahead.
Thank you very much. Thank you, both of you, for this excellent piece of work. I just want to comment really on how often CBT is misunderstood, and you've greatly succeeded in preventing misunderstanding, I think. And it kind of, it gels for me around the SEL model, because people often think that, that cognitive behavior therapy is about thinking somehow more positively, which is kind of like whistling in the dark. And it's not about that at all. The SEL model is really about doing things to find out how the world really works. And the bit that I particularly like is that you're not saying just feel the fear and do it anyway. You're saying do this thing, find out what happens, then learn from it. And that's the thing that brings about the change. And it's that new learning, and it's learning. So people are often have assumptions. Brian put it rather nicely in terms of safety-seeking behaviors or avoidance behaviors. People often believe they're keeping themselves safe by avoiding things and so on. And it's a great surprise when they discover that things they're afraid of don't really happen. And it's very liberating. And so this idea of good cognitive behavior therapy is about finding out how the world really works. So if your tinnitus is going to drive you mad, you need to know that so that you don't go mad. But if in fact the tinnitus doesn't drive you mad, and in fact the anxiety will diminish, and then you will feel better able to carry on with the things that are important to you. It's really important to discover that. And I think that's the thing that comes over very nicely, and it's embodied, I think, in the SEL model. So thank you for that.
Thank you very much, Paul. And Maureen, please go ahead.
Thank you, and thank you very much for allowing me to be part of this panel. And let me just put my cards on the table. I'm a psychologist, but I also have tinnitus, and I've had it for probably 7 or 8 years, and is associated, I think, with hearing loss for me. And when it came very sharply, and I was upset at its presence, and I went to my family doctor, and I got a disconfirmation that, you know, there was nothing we could do about it. It was associated with hearing loss, and away I went, and my distress dropped in part from getting that piece of information, but I also used my own CBT skills that I walk every day in my life with, you know, and I've said this in many different ways, but when CBT works, and this is a bit of a broad statement, but when it works, we get to learn that we're overestimating threat and or underestimating our abilities to cope. So knowing that, that's some of what guided me in my own journey in dealing with this. And so first of all, I did very much appreciate learning about tinnitus, because I didn't know much about it, because I didn't want to delve too much into finding out about it, because I knew that it would make me pay more attention to it, which then in turn I would hear it more. So thank you for providing that bit of information, and you've laid it out very comprehensively, that it very much begins with education and monitoring and teaching people how their thoughts can exacerbate the problem, and how avoidance can make it worse. As my mother used to say, everything is bass-ackwards. That if it's something that to make it better in the short term or in the long run, you have to do stuff that might make it more difficult in the short run. So entering those situations that you think that you've been avoiding because you think it's helpful. And as Paul said, and you've reiterated, learn from them. What does this tell you? And take it back to the disconfirmation of threat and the underestimation of your ability to cope, and the understanding that it's going to go up and down. The severity, the tone of it will change throughout the day, depending, at least for my own self, depending upon stress levels and my own fatigue. But I also know that it will fade and it'll just go back into the background again. So I did very much appreciate being able to have this all of this information in one handy resource. So thank you very much for creating it.
Thank you, Maureen. It was it was very interesting story when I met Maureen for the first time. It was on a CBT conference in Ireland, and she was an instructor of a CBT for OCD workshop in the conference, and I was there, very wanted to learn how it is done, and I was like saying, okay, I'm not going to understand any of it, so I'm just sit down and try to persist. And to open the workshop, Maureen, I don't know if you remember, you played a video from Woody Allen having tinnitus, and which was very interesting for me to hear something that was relevant to me as an audiologist. And that story actually made it to the book as well. we put that as a part of the so thank you very much for all of the knowledge that you shared. And Tricia, please go ahead.
Hi, so I am a clinical audiologist in the United States, much like Robert and Ellie, who have also joined us today. And in the United States, cognitive behavioral therapy is used as a complementary type of management option for our tinnitus patients. And what I appreciate about this book is there is this stigma around mental health and seeking a mental health provider. And a lot of times I find that my patients could benefit from cognitive behavioral therapy, but they are very resistant to actually taking that step and going to see a mental health provider. This book is very patient friendly. I really appreciated the examples that made the teachings be very relatable to the patient. So there's examples with like Moby Dick and Beauty and the Beast, and really helps to, I feel, help the individual who's experiencing tinnitus look at the examples and then identify how the tinnitus is happening in their life. So I just wanted to say that I just really appreciate this book. I think that hopefully that this is a step for patients who might be resistant to actually going to see a mental health therapist for cognitive behavioral therapy, that they can do some techniques and self-help and exercise at home. And then I will also say that there's a section about the CBT Plus, where, you know, when do we bring in a psychologist or mental health therapist when additional support is needed. So all really, really valuable information. And I think that this will be a very, very helpful tool for many tinnitus patients that are out there worldwide. And like Maureen, I too experience tinnitus. I'm not just a provider, I too experience it. And as I was reading through the book, I was like, you know what, I can't wait to actually see if I can apply these exercises to myself and be able to bring it full circle with my patients. So Thank you.
Thank you very much, Tricia. Jemma.
I'd say about the book from my own perspective is someone's actually kind of touched upon the question, the thing that the number of patients waiting to be seen in the hospitals can be very long, and therefore from a patient's perspective it can be quite distressing to have to continue to wait to be seen if you wish to be seen. And I think the book really serves a great purpose in terms of, whilst you are waiting to be seen, then you have this tool that you can follow. I also feel, from somebody who's worked in hospitals for some time with this, that quite often you get people who have relapses and patients come back to you and they want to go through a full course again, when that's not necessarily what they need. Sometimes they just need something to give them that reassurance on how to complete the CBT and how to do that. And I think the book is very useful to do that, because then you then don't have to wait for whatever duration of time, and you've got that resource available quickly to remind you of how to do it, which is probably actually the best option for them.
Thank you, Jemma. Thanks. We have a question which is asking, how long does CBT treatment, how long is CBT treatment for patients with tinnitus? And what do you, how do you define adherence? So that's interesting. Okay. Jemma, how long usually in the NHS are the CBT sessions and entire treatment? And Laurie, you can also comment on your practice in Antwerp.
So in the NHS, we have an assessment appointment, and then you have 6 sessions following this. I did some audit work when looking at the attendance of this. The second appointment to explore it seems to have the highest non-attendance rates, but once they get past that exploration appointment, then they seem to fully understand CBT. The attendance rates are actually very good. We have found that since introducing the video options for CBT, so like using almost like a Zoom call like this, the attendance rates do seem to have significantly improved, which it's a good method of delivery. It's being reviewed as we go. I think, but it's just those initial starting points to make sure that somebody attends.
Exactly. So they come for the general assessment and then come for that second session, which is the interview with them, and try to find out, if you can formulate if they indeed have distress linked with tinnitus and that decision. So if they come for that session, then and they agree that they want to do CBT, then the adherence is going to be.
Yeah, I would also say with that session, something I've noticed from our own experience is that a patient tends to be put on a waiting list again for that second session, and for the sessions after that, you book as you go. And I think then by sort of giving a patient a date and saying we want you to attend on this day, they tend to then turn up, as long as they're giving some dates.
Thanks, Jemma. Laurie, how does it work in your practice in terms of this question?
So in the Antwerp University Hospital, we don't have the same system as the NHS, so we're more free, I guess. So I plan always the intake, which is after the assessment, to give indeed the formulations, and then to see if they understand what CBT can do for them and if they would like to continue. And I feel the same as Jenna, that is very crucial. Then you already feel if the patient has the insight to see, okay, if this will be helpful, or if sometimes they have like a wall, you really see the wall around them, that they don't want to, they're not ready for that insight yet. And then we book 6 sessions after it, and if the patient wants, it can be continued longer. So some of them are really good after 6 sessions. Some of them have, for example, tinnitus and hyperacusis and will take longer. So we have that flexibility to follow up, but often then I decrease the amount of sessions every month, so to try to give them more empowerment of doing it themselves and less interference of me.
Perhaps I can add to that that we say in the book, for most patients, a CBT program for tinnitus management takes between 6 and 14 sessions spread over 3 to 12 months. You should expect to spend a comparable time working through the 10 steps in this book. So we do emphasize that it's not a quick fix. You need to be prepared to spend some time on it.
I think also from experience, it needs to be, the expectations with patients needs to be addressed very early on. You can give them these sessions, but they have got to be willing to comply, and that's very important. They need to make sure they attend their sessions. That's their responsibility, and they've got to complete the tasks they are allocated. And without those tasks being completed, which I think is where the book would help again, is that guidance is that they need to complete those sessions to get the optimum outcome.
Thanks. Maureen.
Yeah, thank you. When I give self-help resources like this one to patients, the way that I suggest it is I say what not to do is to don't read it front to back, because you will get nothing out of this. Read one chapter, do the exercises, live it for a week or two, and then reread the chapter, because almost certainly you will not get everything on the first reading, and you will have that experience of having lived it for the last week or two, and then you'll connect in differently with what you're reading, and then move on to the next chapter. So just to underscore what Brian has said, it takes quite a long time to go through, and to do it properly takes quite a long time to do. So please don't rush yourselves as you're going through it.
Thank you. Ali.
Thank you, Hashir and Brian, for this very nice and useful book for the patients. It's funny that I had a patient yesterday with OCD and tinnitus, so I can see the connection between them, that how a person with OCD can be really annoyed by tinnitus for the past 26 years. So I'm going to introduce these methods to him and ask him to get this book. This book has a lot of important points in it that is going to help us to help the patients and to find a way for recovery. There's a nice statement on page 241 from Buddha that says that Buddha teaches us that pain is inevitable, but suffering is a choice. And then you guys write that tinnitus is out of our control, but whether we suffer from it it depends on us. That means that we have a choice to get better or just feel miserable all the time. So that's very important to teach the patients, that there are ways to help you to cope with your tinnitus. And then nicely put the part about the negative thoughts and the counter statements. That's one of the most important parts that I find in teaching my patients how to remove the negative thoughts about tinnitus. When we combine, of course, these techniques with other techniques that we use in the United States. And you have a nice list of negative thoughts and how generate counter statements for them and how to apply them. And I want to tell you that you have done a great job in this, and I congratulate both of you.
Thank you very much, Ali. There is a question here. What kind of a specific training a therapist needs to be a specialist in CBT? Does each psychotherapist can do CBT? I think this question is good for Paul.
Yes, I mean, the situation is different in different countries, different to the US. But in the UK, the generic cognitive behavior therapy training is actually recognized by accreditation by the British Association for Behavioral and Cognitive Psychotherapy. It's not profession specific. A very high proportion of those trained are clinical psychologists, but there are also a large number of people who are trained specifically as cognitive behavior therapists. That training has increasingly included what are called long-term conditions, and tinnitus would be in that as a persistent physical symptom or a medical unexplained symptom. But not that many, even with that accreditation, not that many people will have a specific training. The other thing to say, actually, again, the book is very helpful, but the evidence for self-help work generally shows that guided self-help is more effective than pure self-help. And it hasn't been evaluated in this particular area, but in almost all other areas of CBT, that guided self-help with an appropriately trained and supervised therapist. So the other thing is a therapist should be appropriately supervised. All therapists, and I'm moderately experienced cognitive behavior therapist, I still receive supervision. We all receive supervision in this way, and that's extremely helpful for that. So it's a little complicated. I think the reality is that there's a scarcity of trained people, but it is improving in the UK. Maureen, you can probably talk to North America, I imagine.
It's done in the context of graduate programs in North America. It is the same in Canada and the US, whether that be within clinical psychology or counseling psychology. And increasingly, there are other professions, social work and occupational therapy. And the latter group, though, gets very little specific CBT training. Most of the theoretical work is done in, and research work is done in the umbrella of universities. And then our practical experience is where you get the hands-on experience, which is supervised.
Thank you very much. And Robert, go ahead, please. Oh, you're on mute still. Robert, you're on mute,
Robert.
You're muted.
There we go. Oh, sorry about that. Well, thank you for inviting me on the panel, and I was very honored to be asked to write the foreword for this book, because both for the readers out there, you always want to be able to read something that's written by true experts, and Hashir's an expert in tinnitus, and Brian I have known for many, many years as an expert in psychoacoustics, experimental psychology, hearing aids. I've learned so much over the years from him. One of the things that I found best about this book is, and I think both Paul and Tricia mentioned this also, that at least in the United States, for 40 years, I have practiced working with tinnitus patients, and I should emphasize practice, because sometimes I was successful, sometimes unsuccessful, and always going with whatever the soup of the day was for what people felt was the most effective treatment. And clearly, cognitive behavioral therapy was the only treatment that was effective for the majority of patients, as opposed to many of the other approaches out there. And one of the big issues was that even as I would give talks around the country, getting audiologists to get involved in this kind of tinnitus management was very difficult, because many of the audiologists felt that they weren't trained, and properly so, they weren't trained in cognitive behavioral therapy, and many felt that that wasn't their area of expertise anyway, and so they didn't want to jump into that field. And on the flip side, many psychologists who were trained in cognitive behavioral therapy knew very little, if anything, about tinnitus. So it became a real problem for patients to find a professional to go to. And I think that this book, of many books that have been out there on tinnitus, is really the only one that really approaches tinnitus management in a very logical, sequential manner for cognitive behavioral therapy. And as I wrote in the foreword, if I had had this book over the last 40 years that I had been practicing, I would have become a much more effective therapist in terms of working with tinnitus patients, because as much as I read in the scientific journals, the practical nature of and the examples that were brought up by Hashir and Brian in this book were so effective that I wish I had had them, like I say, when I was practicing, and I think I would have been able to help a lot more patients.
Thank you very much, Robert. Thank you. And I know that some of you mentioned to me that you have to go right away when we don't have more time than 1 hour. So I'm going to quickly see, are there any of the panel members having any comments to add? Laurie, go ahead.
I just maybe quickly want to encourage people that it's possible to learn CBT, and definitely in this way, as I'm an audiologist and also not skilled as a psychologist. So I got the training from UHealth, and I think when I went through the book, it's structured in the same way that is very easy to understand. And I don't think that patients might be thinking like that they're not able to do that, but I strongly believe that if I, as an audiologist, was able to understand these techniques, that patients can definitely also go there and be successful. So that's what I wanted to add.
Thank you very much, Laurie. Thanks. So thank you very much to all of the panel members for sharing your ideas and your kind words. And Paul, I believe you've shared a link for the training for CBT.
It's for accreditation, but I've just shared it with the panel, so you need to share it with the participants. It basically allows you to identify UK accredited therapists. I don't know, Maureen, is there an accreditation system of the same type in North America?
A couple of different ones. The Academy of Cognitive Therapy, that's not just North America, lists accredited CBT therapists, and a couple of bigger organizations, one in the US, the Association for Cognitive Behavior Therapy, ABCT, and in Canada, the Canadian Association of Behavioral and Cognitive Therapy, CACBT.
Thank you very much. I'm also trying to share this the message that Paul sent to everyone, and lovely, fantastic. So thank you to all, and thank you for your time. I think Brian and I will stay a few more minutes to answer some of the remaining questions, but thank you to the panel members for your time.
Thank you for the invite.
Thank you. Brian, there is a question here from one of my colleagues and friends, Raul Garcia Medina, and he's asking what is the current direct correlation between tinnitus and hearing loss? Does the 80-80 rule serves a good basis? Brian, you're on mute.
It's really hard to answer that question precisely, because it's tricky to define what involves completely normal hearing, and even among people with hearing within the so-called normal range, there may be some very narrow frequency bands where there's a hearing loss which is missed in the conventional audiogram. So you might say, well, as far as we know, 80% of people with tinnitus have some hearing problem too, but it could be closer to 100% if you could measure all aspects of hearing problems. So in my view, it's likely that tinnitus is nearly always associated with some sort of damage to the auditory system, but that damage may not show up in the conventional audiogram and with the conventional definitions of what normal hearing is, which is usually at a 20 dB HL. Anything better than that is considered normal. But there's evidence that even when you're in the range, say 15 to 20 dB HL, that's some degree of hearing loss, and it increases the likelihood of having tinnitus. So I don't think one can have a hard and fast rule. What's a more interesting puzzle is why some people with hearing loss develop tinnitus and some people with hearing loss don't develop tinnitus. And that's still a bit mysterious, I think.
Exactly. And there was a research that I have done with Richard Salvi, and we assessed the correlation between a regression model between tinnitus loudness and severity of hearing loss. And there was some link between them, some direct link, but the actual link was very, very small, and compared to the effect of the annoyance and the anxiety that tinnitus causes on the loudness of it, as opposed to the severity of the hearing loss.
Yeah.
There's a question about, for hyperacusis patients, are these same techniques of CBT, SEL model recommended? Do any alterations needs to be made? So this, the cell techniques for somebody who have hyperacusis will focus on exposure to the noises that they try to avoid, as opposed to a person with tinnitus. The cell technique will focus on reducing the avoidance behaviors in a way of, if they have, like, if they avoid silence. So it's an exposure to silence, if you like. And so it's a different one, but the actual method is similar. And a related question is, how do you manage exposure with a patient who avoids places with loud noise? Because the loud noise makes tinnitus much worse, and they have hyperacusis. So this patient has, they avoid, so the hyperacusis is kind of linked to the fear of their tinnitus getting worse. And then, so that's why they avoid loud noises.
Yeah, I mean, I think this is a difficult case, but I think you can approach it in stages. I mean, in the end, you're trying to teach the person that they can go into places where there are loud noises and they'll still be okay. Nothing really bad will happen, and it may be unpleasant at first, but they'll acclimatize to it. So I think in cases like that, you would probably start by getting the person to go to a situation which is not terribly loud, not say a football match or something like that, but go to a situation where they expect the noise could be loud enough to produce some problems, and then see if it really is causing problems, or if they can stick with it and manage their fear, and then gradually build up from that. What we think is the wrong approach is to constantly try to avoid these situations, and it's wrong to be wearing earplugs or hearing protection, because that's just avoiding the problem and not dealing with the root cause of the problem. But it may be necessary to build up on the exposure gradually, rather than immediately plunging a person in, saying you have to go to a live rock concert or something like that, which might be unpleasantly loud for most of us.
Exactly. And I think in the book, toward the end of it, we talk about the safe limits for the loud noise exposure, and with ear protection and without ear protection. So those are mentioned in the book, the details of it, like for how long you can be in a rock concert with ear protection and without an ear protection, and supermarket, different places with different intensity of the sounds. So as long as we are following that guideline, then there is no risk of a physical damage to our hearing. But it could be uncomfortable for a person with tinnitus if they feel that the tinnitus gets louder after exposure to noises at the safe limits. But because there is no physical damage to the hearing, the CBT skills, if the tinnitus get louder, the CBT skills can reduce the distress linked to their tinnitus. Therefore, brain doesn't focus on the tinnitus. So the changes in the tinnitus should be managed by the use of CBT, as opposed by trying to limit your life so the tinnitus doesn't change. And so that's basically the idea with that. Asking if we are using any specific measures in the book, like TFI. We are not using TFI, but we are using a tinnitus impact questionnaire, Hyperacusis impact questionnaire, SAD-T, and also 4C tinnitus management questionnaire, which people can do before and after. How CBT can help with habituation.
Maybe I can say a bit about that. I mean, the part of the goal of CBT is that once you can improve your reaction to tinnitus, so it's no longer causing you to become upset or angry, once you stop paying attention to it, it does fade away into the background, which is a form of habituation. And so in my case, I have tinnitus, but I'm only aware of it when I actually think about it, like if I'm giving a talk about tinnitus, but most of the time it just fades into the background because I've learned to control my reactions to it. I don't regard it as threatening. It doesn't make me angry. And I like the analogy that Robert Sweetow gave many years ago when I heard him give a talk about tinnitus. And he said, think about the chair you're sitting on. Can you feel the chair pressing against the back of your legs and your bottom? And you say, well, yes, I can. But until I mentioned it, you weren't aware of that at all. And part of the goal of cognitive behavioral therapy is to make that happen for tinnitus. So it's still kind of there if you think about it, but most of the time you're not thinking about it, and so you're not aware of it. And that is a form of habituation.
Exactly. And the idea is that the anxiety that you experience because of tinnitus stops the habituation from happening. And so CBT helps to remove that anxiety, therefore prepares you to habituate to the tinnitus. So that's emotional reaction, stops the process of habituation, and CBT tries to manage that. Another question, is the book for clinical psychologists or for patients? So this book is written for patients, but we are writing another book, which is for doctors and audiologists and clinical psychologists.
Yeah, I should add that although the book is aimed at people with bothersome tinnitus, we think that many audiologists and clinicians will find it useful. And as Robert Sweetow said, he wished that he had the book a long time ago because it would have helped him in his practice. So although the primary aim of the book is at people suffering from tinnitus, we think that it could still be useful for audiologists or clinical psychiatrists, psychologists, or whoever is dealing with tinnitus patients.
Exactly. And there's a question about PTSD and tinnitus and the effect of CBT as a treatment. So the question is, the conclusion was they are within the some areas of the brain, and so the tinnitus, I'm guessing, and they mean that tinnitus and PTSD is some areas in the brain, and which is true, isn't it, Brian? So we do believe that the perception of is not, the ear is not generating tinnitus, it is the perception in the perceptions parts of the brain.
Maybe I can add to that. I mean, that there is evidence that exposure to explosions, like if you've been in military service and you've been near explosions, these blast injuries can actually damage some central structures in the auditory system. So for many people, tinnitus may be triggered by some problem in the cochlea, but it's generated by the response of more central parts of the brain to that injury to the cochlea. In the case of military personnel who've been exposed to explosions, there may be some direct damage to central parts of the auditory system that could trigger tinnitus. But in the end, it doesn't really matter where the tinnitus comes from, because CBT is helping you to deal with the tinnitus. It's not trying to get rid of the tinnitus itself. It may become less bothersome. It may fade into the background after a while, but the goal is to help you to deal with the tinnitus, and that should work whether the tinnitus arises initially from some problem with the cochlea, the ear itself, or with more central structures in the auditory system.
Thank you very much. And another question is, it is normal to use sound enrichment to help the patient with the management of tinnitus sound. How would you combine this with CBT avoidance, or this is counterproductive? So in my view, that, or at least in the CBT that we understand, is use of avoidance techniques like avoiding hearing tinnitus by the use of background noise is not going to address the psychological response that the person have to tinnitus and the anxiety that they have. It is simply an avoidance or reassurance technique. And so in CBT, we want the patient to basically get over their fear that they can't sleep, for example, if they don't have a noise in the background. And when the exercises and mental and behavioral exercises in the book, which basically step by step help them to achieve that. And once they realize that, okay, I can sleep even if I do not use a noise in the background, that's a powerful conclusion, because then that makes tinnitus very insignificant. And the less, when tinnitus loses its significance, it makes it easier for the brain to automatically put it to the background. And that's the idea with CBT. While I do hearing test, PTA, for patients complaining of tinnitus, should I test high frequencies above 8 kilohertz?
Yeah, well, it's not clear that it's necessary. I mean, there is evidence that tinnitus can be associated with high frequency hearing in this range above 8 kilohertz. So some people with tinnitus have audiograms within the normal range up to 8 kilohertz, but have a hearing loss at those higher frequencies. So and that's an interesting scientific thing. I think from the point of view of the treatment by cognitive behavioral therapy, it doesn't really matter because the therapy is designed to help the person to deal with their tinnitus, whether or not they have hearing loss, and regardless of the pattern of the hearing loss. But there's some evidence that damage to hearing, for example, produced by noise exposure, may first appear at frequencies above 8 kilohertz. And noise exposure is one cause of tinnitus. We know that after people have been exposed to intense noises, they often develop tinnitus. Sometimes it's temporary, but it may become permanent after a while. And hearing at frequencies above 8 kilohertz might give you a sensitive way of monitoring for early signs of noise damage, so that you can warn the person, look, you need to avoid going to these very noisy situations. If they're in the habit of going to rock concerts or discotheques or raves, then they need to be warned that they're potentially damaging their hearing. So I think testing at these high frequencies is not necessary for the purpose of conducting CBT for tinnitus, but it may be useful as a tool for detecting early signs of hearing problems.
Another question asks, my tinnitus is not usually troublesome. I can hear it, but it doesn't usually affect my behavior. Should I live with it, or would the recommendations in your book be helpful? The first thing is that the book will help you to establish, does tinnitus impact on your life or not, comparing to the standards, if you like. And so that's one thing. So through that self-assessment chapter, this you can establish for yourself, that are you affected by your tinnitus and associated factors, or you're completely clear. And then also in another chapter is like how confident you are to manage your tinnitus, manage different scenarios. There are lots of information in the book that can help you to understand tinnitus better. And by learning the ideas about CBT, you somehow can prevent tinnitus to become bothersome, because whenever things change in life, tinnitus goes up and down. We are become more vulnerable or less vulnerable to be affected by it. But if you learn the techniques, you kind of can protect yourself against those things. So I would say, if you have tinnitus and if you have no problem whatsoever with the tinnitus, then I guess there is not much of a point. But if you have some concerns, then the book can address those for you. And Brian, this one I think is good for you. Is tinnitus affected more with exposed to sounds that have the same pitch?
I'm not sure I quite understand the question. I mean, it is the case that the tinnitus pitch tends to fall in a region where there is hearing loss. So in the case of exposure to noises, if you're exposed to noise, for example, in a noisy factory, that typically leads to a dip in the audiogram around 4 kilohertz. The person becomes less sensitive at detecting sounds around 4 kilohertz. And often the tinnitus pitch is close to 4 kilohertz, but that's not always the case. You can never be sure. So we can say that the pitch of tinnitus tends to fall in a region where there's hearing loss, and exposure to sounds tends to produce hearing loss at high frequencies, and that's where mostly people hear a high pitch to their tinnitus. But I'm not sure if that fully answers the question, but I hope it gets close.
And the question is, how can we buy the book, and is there any further training on CBT for audiologists and hearing aid dispensers in the UK? So the book will be in the bookstores and Amazon from 6th of October in the UK and from early January in the US. And so you can purchase it that way. In terms of the CBT training, Paul shared a link for CBT training in the UK. I also have a training course called Tinnitus and Hyperacusis Masterclass, which I teach this. And so if you're interested, you can always follow those links. Another question. Is it the case that setbacks for hyperacusis patients are inevitable when increasing tolerance through exposure, and that CBT is the best way to prevent these from becoming a relapse? So it is inevitable to have setbacks. So that is something that's part of the process that is going to happen. There's always something that can cause a setback, but CBT is the best way to equip you to how to manage those setbacks, so not to let it to escalate to a full-blown relapse. But in terms of the through the exposures, like when you are doing the therapy, that doesn't really count as a setback, because the setbacks is once you are up and running and you've used it for a few months and having no problem, you're using the CBT techniques, everything fine, and then suddenly, I don't know, you get COVID-19 and you become more vulnerable, everything is louder, that is a setback. But if it is, you are during the therapy, it's not really a setback, it is just a hard work to actually go through those exercises. Would there be any conflict then suggesting the book to clients who are in a neurophysiological based management program and are using sound enrichment to at least reasonable effect. So is there any conflict between recommending the book to people who are using sound therapy?
I mean, I assume by neurophysiological approach, you're talking about something like tinnitus retraining therapy, the Jastrow approach. And that is clearly a different approach from the CBT approach that we use in the book. The TRT can be effective to some extent, but I think the evidence supporting TRT, the clinical trial evidence, is not as strong as the evidence supporting CBT. So at the moment, we feel that the evidence supporting CBT is the strongest, and that's the approach that we use in the book. I mean, I think sound enrichment, there's no conflict with using sound enrichment in the sense of exposing yourself to a variety of sounds in everyday life. What we say in the book is that you shouldn't be using sounds as maskers to try to get to sleep, for example. That's a kind of avoidance behavior. But we don't see any harm in exposing yourself to a wide range of sounds in everyday life. And indeed, for a person with hyperacusis, that may well be helpful. You know.
Exactly. And in the book, we do mention that, for example, if you want to use a noise to help you to at bedtime, so the reason that tinnitus can interfere with your sleep is not the actual loudness of the tinnitus, is the annoyance and the anxiety it causes. So you really do not need to put a noise to mask tinnitus. Instead, you need to dampen down that anxiety and distress that tinnitus causes, and CBT is the evidence-based approach to actually achieve that. And so that's that. So, well, thank you very much to all. Thank you very much, Brian. Are there any final things that you like to mention, or we covered most things?
No, I think we've covered it pretty well. And I'm encouraged that we had such a large number of people attending. So that's nice. There's clearly
exactly. It's a mix of professionals as well as people who experience tinnitus. So I also like to invite all of you who are listening to our face-to-face event, which is planned for 14th of November in Guildford G Live. That's one of the biggest theaters in Guildford. And in that face-to-face seminar for public, also professionals are welcome to attend. Brian and I will give some presentations about the book. We take questions and discussions with the audience. Also, we have Don McFerrin, an ENT surgeon, who also has written several books, including a self-help book on tinnitus, joining us in a panel, and we answer questions ranging from CBT to surgery for tinnitus and medications, so on and so forth. So we encourage you to take part on our event on 14th of November. And thank you very much for all, and have a good evening. Thanks.